Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, there are currently 1,498 cases of COVID-19 in 77 counties. There have been 8 fatalities in North Carolina associated with COVID-19. Currently, the state is reporting 157 hospitalizations across the state from COVID-19 illness. 54% of COVID-19 cases in North Carolina are people between the ages of 18 and 49. 26% are people aged 50 to 64, and 19% age 65 and over. We have announced the second positive test result in Dare County. This is not a case of community spread. It is believed the individual acquired the virus through direct contact. Similar to the first positive test result we shared last week, this will not show up as a Dare County case with the North Carolina Department of Health and Human Services because a Dare County address was not used when the individual was tested. The individual has been self-isolating since being tested last week and continues to be monitored. The individual's spouse has also been tested, and we anticipate receiving that individual's test result in the near future. I understand the public wants to know more details when we share there is a positive test result. Protecting patient privacy is a legal requirement. I recognize and take very seriously the responsibility we have in public health to protect our community. We will continue to follow communicable disease protocols regarding contact tracing and notification of individuals who may have had direct contact with an individual who tests positive for COVID-19. Please know that we will continue to report on any positive case as soon as possible. The official source for information on positive test results is the local health department or North Carolina Department of Health and Human Services. While only 2 individuals have tested positive for COVID-19 in Dare County, do not let your guard down. We are not immune from this virus. All of us must do our part to adhere to the stay-at-home guidelines. We have been stressing and will continue to stress the importance of social distancing as one of the most effective tools to help slow the spread of COVID-19. Today I want to stress a few other important tools. But before I do, I want to remind you how COVID-19 is spread. When someone sneezes, thousands of respiratory droplets are spread. Those droplets land on surfaces where they can live for days. If that surface is not properly sanitized, someone can touch that surface and then touch their face and get infected. These droplets can also land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. This is why we continue to enforce the importance of social distancing. Social distancing is staying at least 6 feet away from other individuals. In addition to social distancing, there are other simple yet effective tools we can use to protect ourselves. First, stay home and isolate if you are feeling sick. This is critically important whether you think you are sick from the flu or a cold or COVID-19 or any other illness. If your symptoms are manageable at home, please stay home. That means don't go to the grocery store or out in public. Call on a friend or neighbor who can drop off essential items at your front door. Most grocery stores have order online options, and there is also Instacart shop and delivery service as an option. Second is good hand hygiene. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. Wash your hands frequently, and especially after sneezing, coughing, or coming into contact with frequently touched surfaces. The more we wash our hands, the more our hands may dry out and possibly crack. Keep lotion nearby because not only is cracked skin uncomfortable, it also creates a kink in your armor, so to speak, and leaves you vulnerable to picking up other germs or bacteria through broken skin. Third, avoid touching your face. Fourth, sneeze or cough into a tissue or the inside of your elbow. Fifth, disinfect frequently touched surfaces as much as possible. Please know you're not alone in this fight against COVID-19. Each one of us plays a part of the army that is fighting to protect our community. If you find yourself struggling in this fight, please use the resources available in our community to help you. Whether you need support with basic needs like food, or you need emotional support, We are fortunate in Dare County to have resources to assist. You may find a list of these at www.darenc.com/COVID resources. As we move through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center at 252-475-5008. Thank you.